These was the jeans that I used to wear. I didn't have trousers in those days because I couldn't get any to fit. So I basically had to order these from a specialist catalogue, and these are a 50-inch waist jeans, which I've kept because sometimes people won't believe how much weight I've actually lost.
The UK is currently facing a weight crisis. According to The Lancet, more than 66% of men and women are now classed as obese or overweight. With a complement of nutritionists, psychologists and physicians, County Durham and Darlington's NHS Trust is hoping its new approach to weight loss will provide a more long-term effect for patients hoping to maintain a healthy weight.
Obesity is a big problem for us in the Northeast. We have about 180,000 people who are classed as obese with a BMI of about 30. Now, we only had two things for most people who are very overweight. So if you're very overweight, you could have surgery. And for the most part, what you will have otherwise was what you have in the community, like Weight Watchers. Now, what we have is something very exciting for the people in County Durham. You have a 6-month program, I must say, it is 24 weeks, where we actually see patients as part of a multidisciplinary team. Psychologists, physicians, dietitians, nutritionists, physical trainer, and we see them together for this 6-month period. And what we think is that we have a program that will achieve and sustain weight loss, and that's the most difficult bit of it.
The program will be offered to patients with a body mass index of 40 or over, or 35 and additional medical conditions. Although not all those using the service will wish to have weight loss surgery, the hope is that it will help those awaiting bariatric surgery to be better prepared.
Prior to the surgery, I weighed 28 stone and 10 pounds. And I was on the road to self-destruction basically because I was diabetic, I was on insulin, I was on all sorts of medication. A very good doctor there sat and listened to everything I said, and she turned around and told me, you either do something about your weight and your diabetes, otherwise you could be dead in 2 years.
What it means for me as a surgeon is that all the patients that are now referred to me will have worked with specialist medical colleagues, will have had pre-existing health issues like diabetes, sleep apnea optimised. They will have worked with our nutritionalists such that they have the appropriate dietary advice, behavioural changes around food in place. They'll have worked with our team regarding exercise, and also they will have had some input in terms of help with behaviours around eating from the psychological part of our programme.
It's about actually losing 5 to 10% of your weight. So if you're 100 kilograms, if you lose 5 kilograms, you will make a big difference to the incidence of diabetes, the other problems that come with obesity, the arthritis and things like that, makes a big difference to that. And if you can really change the person's attitude towards food and work with them to really do that, then we can make a difference. So I'm not taking it as an easy process. I don't think it's going to be easy, but if you have the commitment, we have the time.